next thing we want to talk about is ARDS, or acute respiratory distress syndrome. ARDS is a condition in which fluid collects in the lungs, air sacs, or alveoli, depriving organ of oxygen. It is often fatal, with risk increasing with age and severity of the illness. It's not always clear what triggers the case, but is generally treatable and most people can recover from it. There are some major anatomic alterations of the lungs that can be seen from a patient with ARDS, including interstitial and intraalveolar edema and hemorrhage, alveolar consolidation, intraalveolar hyaline membrane formation, pulmonary surfactant deficiency or abnormality, and atelectasis. Some of the more common causes of ARDS include, but not limited to, sepsis, aspiration, pneumonia, severe trauma, massive blood transfusion, lung and hematopoietic stem cell transplantation, and drug abuse. But in order to diagnose someone with ARDS, certain diagnostic criteria must be present, such as respiratory symptoms associated with ARDS have manifested within 1 week of a known clinical event, or new worsening symptoms over the past 7 days. Bilateral opacities similar to pulmonary edema appear on a chest radiograph or CT scan. So the opacity can be fully explained by pleural effusion, lobar or lung collapse, or pulmonary nodules. The patient's respiratory failure cannot be fully explained by heart failure or fluid overload. An objective assessment to rule out hydrostatic pulmonary edema is required if risk factors are not present for ARDS. A moderate to severe impairment to oxygenation must be present as defined by the ratio of arterial oxygen tension to the fraction of inspired oxygen ratio, which is your PaO2 over your FiO2. When doing an assessment of a suspected ARDS patient and taking their vital signs, one can see an increase in respiratory rate, heart rate, their cardiac output, and their blood pressure. They will have substernal and intercostal retractions and appear cyanotic. When doing a chest assessment, one could have a dull percussion note, bronchial breath sounds, and crackles. When it comes to a chest radiograph, again, they will have an increased density and a ground glass appearance over the lungs. As for general management of someone with ARDS, there are 3 respiratory care treatment protocols, one being oxygen therapy protocol, so they will give O2 to treat the hypoxemia that's generally associated with ARDS. Second protocol will be lung expansion therapy protocol. You want to use PEEP or CPAP to help offset alveolar consolidation and atelectasis associated with ARDS. Thirdly is mechanical ventilation protocol. The patient will forego a trial of non-invasive positive pressure ventilation and immediately be placed on mechanical ventilation with the use of a low tidal volume and high respiratory rate. There are also some common medications that are prescribed by the physician, such as antibiotics, diuretics, and corticosteroids, to also help aid in the general management of the patient's ARDS.